Fresh cases of the Omicron variant of coronavirus have now been reported in the country from 3 states, Maharashtra, Kerala and Tamil Nadu. These were reported yesterday. Now, Maharashtra reported 4 new cases on Wednesday, while Tamil Nadu has reported its first case of Omicron. Kerala has reported 4 fresh cases of Omicron. And with this, India's tally is currently at around 69. So, a lot of concern around the world over this new strain of coronavirus that's spreading rapidly at an unprecedented rate is what the World Health Organization has said. To talk more about this, we're joined by Dr Anpuma Gotimukula, MD, President, American Association of Physicians of Indian origin. Thank you so much for joining us there from the US, and Dr Nagarjuna Maturu, Consultant, Pulmonology and Sleep Medicine, Yashoda Hospitals, Hyderabad. Dr Nagarjuna, first to you, what is your view of these cases of Omicron right now? We've only been testing those who've come in from abroad, 69 cases or so being reported, but clearly, as the World Health Organization says, it's everywhere. It's spread in various countries and it's spreading at an unprecedented rate.
Good morning. So what, as a health expert, we feel is that definitely we are looking at sort of a third pandemic in our country. And it is very likely that Omicron is going to create a significant surge in the number of cases. This is for 3 reasons which we feel so. First is that the rate of infectivity. So the data, whatever has been generated, clearly says that Omicron is much more transmissible than Delta. To the tune that it said that if it is 2 to 4 times more contagious than the Delta. The Delta itself has created such a havoc in the second wave that if you have a virus which is 4 times more faster, more transmissible, then it is very likely that the number of cases are going to go up. Second, very important thing is that the vaccine escape phenomenon.
Yes.
So till now, whatever viruses we had, they were not causing second infections. So people who were actually double vaccinated, who had recovered from a COVID, had a much lesser chance of developing second infection. But the data from the Western world, data from the UK, data from the Ireland, where 70 to 90% of the population are already double vaccinated, even in such countries, Omicron is creating a significant surge in the number of cases. So if you look at a country like ours, where only 30% of them are double vaccinated, and even if these 30% stand a chance of getting a reinfection, then it is something which is very, very serious. The third important reason why we feel that Omicron can significantly go up is the fact that people have just regained normalcy. So there are gatherings everywhere, there are family functions, people are actually going to the theaters, they're partying, the travel has regained. So the health awareness amongst the public that the Omicron can actually create a havoc is still less.
Right,
so
and massive political rallies as well. Let's not forget that's where we've been seeing the huge numbers of people gathering. Dr. Anpuma, in India currently it's really this wait and watch. It's a lot of uncertainty, especially with the media, the doctors, as you can see, waiting and watching. The public at large is out and about. But what is the situation there in the US right now?
So in United States, right now we have 3% of the new cases are Omicron, and so it's slowly sweeping under the blanket. But good thing is vaccine. So in United States, 61% are double vaccinated, and recent data what we saw is those who got the booster dose are almost 100% safe. So it's a very mild variant because of it is multiple mutated variant. So the infection rate is high, but it's milder version of all the COVID we have seen in the past. So I think the message is to get vaccinated, and because it's a very highly transmissible virus, you don't want even to get the mildest cold symptoms. So wearing mask is always good. So please wear mask wherever we go outside. When you step out of your house, I think we have to wear the mask. and reduce this spread of the virus. I think it's a good virus in the way it was Alpha and Delta, but this is the mildest variant. I don't think we should panic, but at the same time, we should follow the precautions, wearing mask and getting vaccinated. This is the message we would like to give on behalf of American Association of Physicians of Indian Origin.
All right. We also have Dr. Rajesh Parikh joining us. And Dr. Rajesh Parikh, seeing what's happening in the UK right now with, thousands of cases, the maximum they've reported in a single day, they're being reported over 70,000 cases. What is your view, and balancing that with the information so far that does say that the cases seem to be mild in most of the individuals who are testing positive. In India, at least, most are asymptomatic.
Right. I think the signs have been loud and clear for quite some time now, and it is about time we paid attention. We are perhaps not that worried. Perhaps we are putting a set of complacency because the cases are not severe and because there have been virtually no deaths, just one or two here and there. And in that, Gargi, the danger is that a large number of people will continue to get infected by this highly transmissible mutant variant. And although some of these will go to the hospital, that will become a large number in itself. And then, beds will not be available for patients who need to be admitted for other illnesses. I keep reminding everyone that in the 1 month following the first 3 cases being detected in Botswana, while there was only 1 death due to Omicron, there were 3 million deaths. That's a lack of deaths every day due to other illnesses, which are either preventable or curable or treatable, such as cancer, cardiovascular disease, diabetes, diarrhea, depression, a whole lot of other things. So we must not lose focus of the fact that we want to minimize hospitalization. And as has been appropriately pointed out, the right measures. To that, I only have to add, we need to get on with our boosters very fast, particularly for our vulnerable population, immunocompromised patients, and healthcare workers who have been long overdue for their boosters.
Right, because that is a demand that's been rising more and more. Dr. Anpuma was talking about how in the US they have booster doses, and in those people it's found that the Omicron doesn't have that much of an impact. So Dr. Nagarjuna, really we need to all push more to get those booster doses, but at the same time, as you pointed out, we have low so far we haven't reached that 60% vaccination for all our adult population. So it's really a balancing act, and at the same time we also have information that we have vaccines that are about to expire this month. So, given all of this, what is your view?
Now, I think vaccination is something which has to be prioritized. So people who have not got the first dose should get the first dose. Who haven't got the second dose should get the second dose. Who have got both the doses should get a booster. I think in 3 to 6 months after the second dose, we're seeing that the immunity is waning down. And definitely the data from across the world says that having one extra booster will definitely increase your immunity levels. So vaccines, definitely yes. Boosters also, we would strongly recommend that the government has to come forward, and it is high time that the government actually officially declares booster dose that it has to be taken. But it's also important for us to know that we already have Omicron in our country, and the doubling time for Omicron is hardly 2 days. So even if we roll out boosters now, by the time a significant proportion of our Indians get vaccinated with the booster, it will be likely 2 to 3 months from today. So just because we are having boosters, it doesn't mean that we will follow the social norms. So because at this point of time, the most important thing which can halt the progress of Omicron is 2 things. We should ramp up our genomic sequencing. We should expedite the genomic sequencing, identify all the cases faster, isolate them as strongly as possible, because even though the data is coming that up to 20% of the Omicron positive people are not found, which is actually the fact, because many of them are actually absconding. We don't know where they are. So a very strict isolation is required. Plus, a booster is definitely there because it's going to help us in the long run.
Right. Dr. Rajesh Parikh, if we take a look, visuals all around in Maharashtra and Mumbai especially, yes, some measures are being announced, restrictions in the face of this new variant. But if we look, we have political rallies taking place, UP elections are around the corner. So on one hand, you have the center and the health secretary telling states various measures and ramp up this and that. But on the face of it, with the fatigue having set in, people really just don't seem so bothered. What can be done?
Oh, absolutely, Gargi. This is deja vu. We're just having a slow replay, as they do in sports sometimes, but this is a very sad replay of what happened before the second wave. Political rallies, Kumbh Mela, festivals, people unmasked because they had got over the first wave and were now lulled into a false sense of security. And the only solace, if one wants to grapple for some solace, is that we are not dealing with severity and lethality. But I think we need to learn from the past because, as has been said, those who do not learn from the past are condemned to repeat it.
Right. And finally, Dr. Anpuma, this has also brought the focus on vaccine equity and the need for nations like the US, the UK to ensure that more vaccines are there for other parts of the world as well. Otherwise, we're all at the threat of new variants emerging.
Right. Yeah, you are right, Gargi. Yes, there is inequity in the vaccines. Some countries do not have access. Some countries have surplus, and there's a lot of wastage also because of the expiration. So I think United States is helping most of the countries who are not having vaccine. They are sending vaccines and they are helping. And Pfizer and Moderna are going to go in every country pretty soon. They're ramping up the production, so it's a good thing. But right now, this is the most fastest spreading virus. We do not have time for vaccine. We have to learn some lessons from the first and second waves. This is a third wave. If we still did not learn our lessons, I think we are behind in our thought processes. But acutely right now is wearing masks. It's very, very important. Wear masks and use as much hand sanitizer as possible. Social distancing is not possible because of the winter and coziness in most of the Western world. It's the winter time, so it's inevitable that people stay indoors. So the virus will spread very fast if even one family. But what we noticed is vaccine is definitely helping those who had.
Right.
It does help in a family when wife, husband, both are exposed. One of them did not get the booster and one got the booster. The one who got the booster is tested negative. So this is interesting finding where we saw it here. So
right.
I think the booster is definitely helping, but since there's no time, and this is a early rise of cases before it picks up to thousands and thousands and
no,
thousands.
absolutely, what we're seeing happening in the
now. Yeah, we
right.
need to act now, and we should ramp up the vaccines. I will give you one advice for India. I know I'm from India. I stay in United States, but my heart is in India. But we have every village, go get the camps, get the vaccine, go village by village, and let all of us get vaccinated. We can help in any way, AAPI,
right.
to see how we can help out. But I think the message is vaccines and masks.
Right, we need to really push vaccines, vaccination drive again in all the villages like we were doing earlier, and of course push for boosters, all of us. Thank you so much, doctors, for joining us on the program this morning.
Thank you.
Thank you. Thank you, Gargi.
Thank you.